This is the closest we've been to repealing and replacing Obamacare.
Close, but no cigar yet for the American Health Care Act. It faces stiff opposition in and out of Congress.
If it's something that's not affordable, eventually it goes away.
That's the governor in D.C. What happens with the Obamacare replacement for Floridians now covered?
Some 3, 4, 5-year-old child that was brought across the border did not break any law.
Congressman Carlos Curbelo steps up with a bill to protect dreamers. We will take that to the roundtable.
Good morning. We have today just half an hour with you and a lot to cover with the redo of health care coverage.
The effort to repeal and replace Obamacare is underway now in Congress with the Republicans fully in charge. This week, we got our first look at the American Health Care Act from its chief sponsor and advocate, House Speaker Paul Ryan. He calls it the last best hope for Americans to get good, affordable, market-driven health care.
Though still no clear answers on costs and consequences. And in Florida, more than 500,000 people are insured through the Affordable Care Act. And we begin right there with our guests. Dr. Caroline Mortensen, who researches health economics and teaches at the University of Miami, and State Senator Rene Garcia of Hialeah and elsewhere, a veteran lawmaker who has become a go-to expert in Tallahassee on healthcare policy and programs. Good morning.
Good morning.
And thank you so much for being here.
Dr. Caroline, great to have you come in. Let's begin with a very basic question, and I want to keep this at a basic level because it's so complex, healthcare coverage. This is what you teach. 1.7 million people in Florida have health insurance through the Affordable Care Act, Obamacare. They're worried. How worried should they be?
Well, that's a great question. There's still a lot of uncertainty how this bill is going to move forward in the House, whether or not the Senate Republicans would agree to vote on this, and how the insurance companies would respond over time. So they're sort of going to keep on with the plans that they've already put out there, make decisions about the plans they'll put out for next year. They have a couple more months to make decisions on that.
But not long, really.
Not long. And then the question is, what will the subsidies or the advanceable tax credits really look like at the end of this policy? And will it be enough for people in these districts to continue to purchase affordable health insurance coverage?
And that is the two key words, affordability and accessibility. You know, we were talking, Senator, your districts have the highest number of Obamacare enrollees in Florida, and Republican districts as well. What are you hearing from them?
You know, I think people are a little concerned of what may come. I still believe that there's still a long way down the road until we get to a position whether they're going to get rid of it or not. I tend to believe that we're not going to get rid of the Affordable Care Act. I do believe that we do have to fix it, Michael. You know, what we've been saying for many years is the Republicans and Democrats have been saying that this has been the best thing since sliced bread. Republicans have been criticizing this, saying this is the worst thing. And we know that it's somewhere in the middle. It needs to be fixed.
Well, is there, it's not a black and white thing. The president acknowledged this is really complicated.
Right, it is complicated.
But really what it comes down to, and why it's so political, I don't think I still understand, but why when you take the cost structure of what the changes look to be, and the Congressional Budget Office hasn't even weighed in on this yet, but it looks like it's shifting the costs from, it's spreading out the costs, I guess is what we should talk about. And then the benefits are people with a bit more income and corporations, taking away from the more fragile and challenged populations who might need that kind of subsidy. Is that fair? And how does that work?
I think that's fair. I think right now, under the Affordable Care Act, the subsidies are based on income. And they sort of decrease as your income increases. So this natural sort of relationship there with your income. Under the new proposal, they would be more of an age-based subsidy. They'd be advanceable tax credits, which the Democrats do like to see, but the concern is that they wouldn't be large enough to make the coverage affordable for very low-income populations that in Florida are not eligible for Medicaid expansion because Medicaid is, Florida is not a Medicaid expansion state. So the other concern is how will Medicaid in Florida continue to be financed?
Well, and that is the question, Senator, and that's part of your expertise. We're glad you're here. There are 4.1 million people in the state of Florida who get their health coverage through Medicaid, and it's a huge part of the state budget. With the new American Health Care Act, there are going to be apparently block grants that will go to the states like Florida. Florida chose not to expand Medicaid. What's going to happen now?
Look, the block grants seem like a good idea in notion, but what happens with those block grants is when they give that money to the states, there's no strings attached to that money, and that means the states can use that money to however they want to cover whatever population they want. That's great, but what happens is when that money runs out, it runs out. It's done, and you would have to wait to the following year. And I think those block grants are a great incentive, but I don't think it goes a long way to make sure that we cover the most needy in our state.
Well, are we looking at a change, a shift in paradigm where, or did it already happen, where people who are on Medicaid get a voucher, go to the private healthcare market, find their own insurance plan?
No, that'll be great if you have a truly robust system, a free market approach here in the state of Florida, and that's something that we wish we had, Michael. But when you look at the problems of the Affordable Care Act and what's happening in the state of Florida, I see this time and time again, we were talking before we were on the air, is that if we don't control drug prices, we're not going to get our hands around this.
Well, isn't that a federal issue rather than more than a state issue?
It's both federal and at the state level. The problem that we have at the state level, that what Big Pharma is doing is that they're giving a big numbers of rebates to the state of Florida so they can put their drugs on the preferred drug list. So then Medicaid patients will, that's the drug list that they have to use, and that's the key. That's the root of a big portion of the problem that we have in healthcare right now, is a rising cost of drug prices, and it's been traded as a commodity. Every month it goes up, it doesn't go down. It keeps on going up and up.
So the drug prices are part of the cost of care and part of the cost of medicine. So this act, well, Obamacare allowed more people to be insured. But not everyone who is insured is going to need to dip into the insurance because they're healthy. So it seems like this act controls more of the cost of care. And so how do you cover people, but also how do you provide people the medical care they need at an affordable price, insurance or otherwise?
I think the cost cuts are a blunt instrument, so it's sort of going to be across the board implemented, and then you have to see how the effects trickle down. So it's difficult to figure out how people are going to get access to coverage, what types of coverage are going to access, what's affordable now may not be affordable in the future.
And what does it matter that you can cross state lines? Because let's say somebody finds an insurance company in Arkansas that they like and they can afford. Doesn't the insurance company in Arkansas have to then base their calculations on the cost of care in Florida where the customer is?
And that's what the free market principles will apply. That will be up to the individual company to determine whether or not they want to sell in different states. I think it's important to, I'm a firm believer that you should open it up and let the free market dictate how it's going to run, and the plans can offer different plans in different states. And what happens, Glenna, is that most times states have different mandates. They mandate what coverages need to be covered, and they do it all on their own. So if you have a wide variety of different mandates, people can pick and choose as to what plans best fit their needs and their family needs. And that's why I think it's important to be able to open it up. But again, the devil will be in the detail, making sure you have a regulatory scheme that will encompass all 50 states, not just, or you could do it regional.
If I could just follow up on that question.
There are already 7 states that do sell across state lines or have permission to sell across the state lines, but there are 0 insurers that are actually willing to participate in setting up and negotiating the contracts within each of those different states that it would require to really have a health plan.
Yeah, Dr. Mortensen, if I can, let me ask you about one aspect of this proposed American Health Care Act that I just don't see, frankly, how it works, and that is it removes the individual mandate, which says everybody has to buy insurance or pay a penalty, and yet it still accepts anybody with pre-existing conditions. But don't you need the young, healthy people to have insurance to pay for the people with pre-existing conditions?
So it's complicated because it's part of a reconciliation act, so it can't actually remove the individual mandate, but what it can do is say that the tax penalties are not going to be collected. So it in effect removes the individual mandate.
Right. Well, they want to make that retroactive to 2016, I
exactly,
believe,
right.
on the penalties.
Right. So you no longer have the incentive for less healthier people to purchase into the health insurance plans. As the prices continue to increase, healthier individuals will decide to not enroll, which means the premiums go up, and it's the death spiral that we've been hearing about on the news.
Senator, on Monday, we are expecting the Congressional Budget Office, which is the nonpartisan office that measures the cost of any piece of legislation, to issue its estimate of how much the American Health Care Act is going to cost. And already the Brookings Institution, other think tanks are saying one of the things that's going to say is that 10 to 15 million Americans are going to lose their health care insurance. Do you think that's a good estimate?
No, that could be it, and but that's why I tell you this is something that should not be rushed. This is something that we need to talk about and have a dialogue and a robust conversation on how to actually fix it, not just to get a win. It's not about getting a win or one party winning over another one. It's making sure that those people that actually need this health coverage have it and have access to it, and that's why here in the state of Florida we keep on having these dialogues and conversations and debates every legislative session. But until Washington D.C. doesn't get their act together, we're not going to see any comprehensive piece of
we
legislation.
could say that with regard to almost everything.
Yeah.
But anyway, Renee Garcia, great to have you come in.
Good to be here.
Caroline Mortensen, thank you for being here, helping to explain a really complex issue.
And please prepare to return.
And this is the first of many installments.
Yeah. And coming up after the break, time for the roundtable. Stay with us.
Oh my goodness, we have a great roundtable panel with us today to take on the news of the week for informed opinion and some analysis.
And some introductions first. Mary Lee Cancio is a Miami attorney, active in the Republican Party, and a member of the Governor's Commission on Healthcare and Hospital Funding. Rafael Yanis manages research contracts and policy development at Jackson Memorial Hospital. Melba Pearson is Deputy Director of the American Civil Liberties Union of Florida and a veteran prosecutor, formerly with the Miami-Dade State Attorney's Office. Good morning. Welcome.
Good morning.
Great to have
First
you
timer?
all come in.
Yes.
Mary Lee Cancio, I think we saw huge momentum in Washington this week to get the American Health Care Act through the House. I mean, it passed two committees, including one committee that Representative Carlos Curbelo sits on. He voted in favor. And yet, this rush, this momentum is going to necessarily slow down, isn't it? I mean, the Senate isn't going to just sit back and take whatever the House passes whenever it passes it.
You know, unlike the Affordable Care Act that was not so affordable and nobody read before passing over 2,000 pages, we're going to take our time to do this right. And I think that they're taking the right steps. We're going to eliminate the mandate, we're going to eliminate the taxes associated with Obamacare. And when you speak about millions of people being insured because they have to be insured or they have to pay a tax, doesn't mean they have better health coverage, they're healthier. So I believe that this new plan is going to improve the health care of Americans in general.
Yeah, Rafael, what we really didn't talk about in the first segment was the effect on public hospitals where you work. You know, Miami-Dade and Broward, the public hospitals take care of a lot of people and get a lot of taxpayer money to do so. What is the effect of as it stands, this American Health Care Act on public hospitals?
So speaking in a very personal capacity and not on behalf of my employer, I could say that the taxpayers are going to end up paying for care for the uninsured or the underinsured in one of two ways. You're either going to pay through it through your income taxes, or you're going to pay through it through your property taxes at a local level, or you're going to pay through expanding Medicaid. And that's something I wish we could have heard more from, maybe in the future, hear from our state legislators and senators, hear from them as to how they want to attack the giant elephant in the room, which is how are we going to handle the Medicaid expansion gap, meaning those people who make too much money to qualify for public assistance outright under Medicaid, under the current rules, and those people make too little money to afford a valuable health care plan that will meet their needs.
Yeah. So safety net hospitals like Jackson, Broward Health, they already had lost the low-income pool money, which is millions of dollars. I know I've spoken to your boss, Carlos Magoya. I mean, there's a good deal of anxiety at Jackson, I'm sure at Broward Health, and other hospitals.
Well, the low-income pool funding, known as LIP funding, has been reduced dramatically, and it's going to taper off. And so that was meant to help our community-based hospitals and to help public health systems meet the needs of their communities. But the fact is, if you're not going to replace that with other government sources of funding, either at the state level or the federal level, we have to have a very frank discussion of how we're still going to provide that first-class care to all of our residents.
Yeah,
Right. Absolutely.
You have such a unique perspective professionally on this.
I do. And the thing that concerns me the most is what is going to happen to our poorest, our folks who really can't afford health care. I mean, Planned Parenthood is going to be defunded as a result of this. And 1 in 5 women nationally rely on Planned Parenthood for their health care, for breast cancer screenings, for family care, family planning. So where are the provisions to be able to assist women and people with disabilities?
Because and Melba, to point out something which I'm sure most people, well, I hope they're aware of, is that abortion services for Planned Parenthood accounts for 3 to 4% of all the work that they do, and federal funding for abortions have been outlawed for years.
Absolutely, Michael, that is correct. And a lot of people get caught up in the abortion part of it, but not the fact that folks go there as their primary doctor.
But it's important to say that Obamacare doesn't cover abortions either. The Hyde Amendment, bipartisan, there's no abortions covered under Obamacare or the American Health Care Act. So that's separate and apart. I believe that people are going to get coverage. I'm the pro bono lawyer for League Against Cancer that provides a lot of free services to our community, some of the ones that you were mentioning, and they don't get federal funding. It's local funding that they receive through, the state and donations.
Yeah.
I believe that the American Care Act, I love the name American, that people are going to receive credits from $2,000 to $14,000 a year to pay towards their health care, and they're not going to be taxed or receive a fine if they don't have it. They'll be able to go to their neighborhood doctors or to find other forms of health care. Right now, there's 1 in 3 counties in the United States only have one plan under Obamacare. That's crazy.
So bringing the onus back to the individual is
which, if this plan was so great, then why are so many respected organizations coming out against it, including hospitals and
the
doctors?
American Medical Association, Nurses Association, there are a lot of people who are against it. It's in the very early stages. Well, hold your thoughts. We've got more to talk with on our roundtable. We'll be back in just a minute. Welcome back, live in our studio this morning, guests on our roundtable, and I want to move the discussion now to something called Recognizing America's Children Act. And Melba, the ACLU has been a strong proponent on behalf of these children who were brought here by their parents from other countries, and then they overstayed their visas, and the kids are caught in this bind. They were protected by DACA, by the executive order from President Obama. Now, Representative Curbelo wants to protect them through an act he introduced this week. Kind of a gutsy move on his part.
Absolutely. And, I definitely want to congratulate and thank the representative for taking the stand, because we do need to protect our children. And there's so many children here who are stuck here because this was not their choice.
Right.
But now they're stuck in a terrible situation where they could be returned someplace where they don't know anyone, they may not have any family. Right. So that's something that would be tragic. So I applaud his efforts on that. However, there's still 925,000 unauthorized immigrants still here in Florida.
The dreamers, as they call that, the act to sort of for a path to citizenship died in the Senate last time. Mary Lee, what's changed this time, if anything?
I think everyone in this roundtable is going to agree that we need bipartisan support for major immigration reform. DACA was great, but it didn't accomplish much because with the stroke of a pen, President Trump could have eliminated it. But I believe that people like Helen Aguirre-Ferrer, that is a special counsel to the president, is a good influence on the president, and I believe that him not touching DACA is a great sign that, we are going to accomplish immigration reform under this president. That is really my opinion, because something has to happen. And those children, those dreamers, and many that go to Miami-Dade College, they need help. But that can only happen when both sides come together, and a good negotiator like Donald Trump is going to accomplish that.
Raphael, in fact, I think in his own district, Representative Curbelo represents South Day down to Key West. I think that there probably is basically a lot of support for this act that he's introduced, but nationwide, a lot of conservatives heard Donald Trump during the campaign say, I'm going to revoke DACA first day. He's had a change of heart.
Right.
But Representative Curbelo is going to take some heat for this.
He's going to take some heat, and he's part of the House leadership team. He was, as a freshman, made a member of their whip team. And he does deserve the credit that Melba is giving him and Mighty Lee was referencing, as do Congresswoman Ileana Ross-Layton and Mario Diaz-Balart, who are original co-sponsors of this legislation. We do need to increase the bipartisan support, mainly to get past the conservative hurdle which is there are conservatives, particularly along the border states, who have districts on the Mexican border, who have families that Donald Trump has given a lot of voice to these families, who have been victims, or members of their families have been victims of crimes from illegal aliens or undocumented immigrants. It's not to say that every undocumented immigrant has committed a crime. This is actually a fantastic pathway to citizenship for those citizens who came underage, under 16, and want to serve our country in the military, have a productive tax-paying job, or get higher education and contribute to society down the road.
Have been schooled
But
here.
I would disagree with you that one thing is against the other. Just giving voices to the family of victims has nothing to do with immigration reform. I think he did write to those families that nobody was listening to. So I still think that we can accomplish immigration reform.
Well, I disagree. I disagree that we have not been listening to folks who have been victimized. Immigrants commit crimes at a lesser rate than natural-born citizens. It's a false narrative that's being put out there. The reality is we already deport any immigrant that has a serious felony is already being deported. Right. So this is nothing new. This has been happening for years. I know this as a prosecutor.
And that is going to be the final word because, unfortunately, we are limited to half an hour this morning. Thanks for coming in. Come on back. We'll do it again.
We are cutting it short today because we have our own checkered flag to make way for the Grand Prix racing, and that is up next.
Always want to hear from you. Here is how to reach us. Remember, stay informed, get involved. We'll see you next week. Bye.